Hello, my name is Amaya Thomas.
And my name is Drew Buggs.
Thank you so much for joining us as we discuss the intersection that we explored between adverse childhood experiences, or ACEs, and social determinants of health. The phrase adverse childhood experiences encompasses many forms of trauma, such as neglect, abuse, or generational family trauma, that occurred before the age of 18. These incidences can have significant enduring impacts on an individual's mental, social, and physical well being. Similarly, social determinants of health encompass deterrents such as community safety, access to healthcare, and socioeconomic position, presenting as equally important. ACEs and social determinants of health work together cohesively as an influence to health outcomes for individuals and communities, frequently perpetuating cycles of deprivation. For this study, we collaborated with a California based foster family agency, Alternative Family Services. Using a combination of methodologies, we gathered qualitative and quantitative data from 17 participants ages 19 to 47. Our survey focused on experiences with ACEs, present social determinants of health, and protective factors that were designed to lessen the consequences of trauma. It had 31 scalable questions in addition to open ended replies.
According to our findings, 50% of participants suffer from mental health issues, with a predominant reporting of anxiety and depression, and 79% of participants had been victims of physical, emotional, or other forms of abuse. According to the poll, 57% of participants had some level of exposure to illegal activities from parental figures, and many of them felt alone and unsupported as a child. Despite these difficulties, a few individuals mentioned resilience elements that supported them in overcoming traumas, such as counseling and social support. These findings have important ramifications as they emphasize the urgent need for trauma-informed treatment and experience-specific therapies. In addition to psychological consequences of ACEs, effective measures should address possible institutional injustices that contribute to them, such as poverty and limited healthcare access. For individuals impacted, expanding access to community-based, culturally competent mental health care should significantly improve results. Limitations in the study include a small sample size and a narrow focus on foster youth adolescents, and it doesn't fully represent the general population. Furthermore, self-reported data of events that occurred prior to participants reaching the age of 19 may add recollection biases. Lastly, the cross-sectional design may not capture long-term intervention results.
That sounds like a lot. So, as we sum everything up, it is essential to express that our research emphasizes how important it is to take a comprehensive strategy preventing trauma and systemic injustice cycles. Individual and structural concerns should be taken into consideration in order to provide pathways for healing and equity. We would sincerely want to thank the study participants for sharing their inspiring stories, as the study would not have been feasible without your resilience and vulnerability. Alternative Family Services deserves recognition for their support, guidance, and sharing of resources. We are especially grateful to Dr. Calnon and Dr. Fisher, as well as the faculty, staff, and educators who continue to guide, inspire, and educate us and our peers. Furthermore, our village, the people who have supported, inspired, and encouraged us along the way. We thank you immensely.